is just zooming by. So welcome everyone. Let's go ahead and get started. And we're going to do welcome and introductions. Yeah, you can see I have done something wacky with my slides right there. Bear with me. And we're also going to do something just a little bit different this morning and see if we can recapture a little bit of time. So it's a bit of an experiment, and I think 2023 may be UCCCN's year of doing things just a little bit differently and trying some new things. And in that spirit, what I'd like to do this morning, instead of taking the time to go through every single person in introductions, is just ask you if you have the ability to do two things. Thing one is to put your name and your role and your affiliation in the chat. And Michelle, do you want to do this as I'm talking, kind of to give an example?
Yeah.
And then we'll also ask you again, if you have the ability to, or if it's not too difficult, to go ahead and rename yourself in the profile box for Zoom. And again, not everyone's going to be able to do that, but I'm going to show how to do that while Michelle's putting her information in the chat. I almost can spell. Okay, so I just renamed myself in the chat, and or rather in my little profile box by my picture. And then Michelle has put her information in the chat, and this is what we're going to try today. That way everyone will have the ability to go into the chat, I hope, and see who's here, but we won't take the time to actually go all the way through. So please take a second and do that as we get started. Thanks, Heather. And again, you've heard me say this before, and I'll say it again. We love it if you feel comfortable putting your camera on. And if you don't, we get it totally. But if you're able to, that would be fantastic. Love to see your faces this chilly February morning. All right, so now I'm going to move into my next slide, which has skipped the agenda. So I'll go ahead and tell you that from memory now. We're going to take this first 15 minutes or so to do some announcements. We'll do the chat introductions, and then I'd also like to try and use that time to, well, I think that's it. We'll do our announcements and we'll do our welcome and introductions that way. And then we'll take the next 15 minutes or so to do our brainstorming section, which is where we like to have you utilize that time to bring up anything that's going on in your clinic, in your practice. If it's a case that you'd like some help with, if it's an update on a case, if you'd like to talk about any quality improvement projects that you're working on, anything else that's just noteworthy that you'd either like to share or ask for help with, that's really your time, and we'd love you to use that from about 8:45 till about 9. And then at 9 o'clock, we're really excited that Eric Christensen is going to take some time and talk with us this morning about Utah's Maternal Child Health Block Grant, which is part of our Title V initiatives in Utah. And it's going to be interactive. We're excited about that. And we'll get to learn something. All of us will get to learn something this morning, I think. So we'll give him that time. And if we end up not using our full time and ending before 10 a.m., I don't think anybody's going to be too sad. I promise we will end promptly by 10, but there's a chance we'll go a little bit less this morning. So again, we're just trying things out. So terrific. Thanks to everyone who's been putting their name, role, and affiliation in the chat. And we'd love you to continue to do that if you're just joining us. And we're doing that this morning in lieu of going through and having everyone actually introduce themselves. We're going to save a little bit of time that way. All right, very good. So we've mentioned this before, that if you're able to do Zoom on your computer, desktop, or laptop, that's typically the best experience, but we will take you any way we can get you. All right. So let's talk about our announcements for just a minute. I think you've all been made aware of the new Facebook group we've put together. It's a private group, so it does mean you either have to ask to be invited or to join, or you have to be invited specifically. And I found a few challenges with that. So I took kind of a break. I didn't want to keep spamming people is what it felt like from my end. But I think the easiest thing I found, given Facebook's requirements and restrictions and email issues that we've come up against is that I'm going to go ahead and send out the link to the Facebook group via our listserv. And that means everybody's going to get it again. And I apologize because we have about 30 people who have already joined that. So if you're one of those, my apologies, ignore it. And if you're not and you're interested, we'd love to have you join. We'd really like to see what it can do. So watch that coming out probably later today.
Mindy, sometimes with these Facebook groups, there's a couple out there. There's Autism Council and a few other ones that it's really hard to get into, and you have to, so you're inviting them, I believe, but sometimes you have to do it off the actual Facebook page and invite them in via email from there. So if you have any more problems after you do this,
okay,
talk to me about it. And it's basically just the admin can invite them, but sometimes they have to be friends with someone in the group. So let's hope our settings are not there.
Okay.
Because I've seen a couple that have gotten really messed up.
Okay. I feel like we haven't seen those problems, but thank you for the heads up. That's much appreciated. All right. Let's keep going. All right. So I meant to get this sent out prior to today, but better late than never. Don't know if you guys are familiar with this Kyo Care. It's ABA therapy, and it's a company that's bigger than Utah. They've got locations, I think, all over the US, but they have some locations in Utah. And when they arrived, we somehow became aware of them, and we've got them in our services directory. But they had sent Michelle, for some reason, an email about 4 free webinars for parents. The very first one was about ABA, the Kyo way or something, very proprietary, I'm guessing. Well, I don't know, but that was the name of it. And we've missed it. It was February 6th. So I've just put these other 3 in here. And when we send out the resources of the month meeting summary email, we'll make sure that the link to be able to see more about these is in there. And Tina took a quick look at these for us and felt like they probably had some value, and they're free. So FYI, and do with them what you will. All right. Okay, we just always want to remind you about Spark. And if you've got questions about that, or you'd like materials to hand out for that, all those details will be in our meeting summary. And we would love you to take advantage of that, particularly the fact that they now are, they have a whole side of the program in Spanish, which is pretty cool. All right. Wanted to let you know about the goings on with our pediatric Project Echo series. We're fully in the middle of our spring 2023 session. And we have a presentation today on irritable bowel syndrome, as you can see there. We also did one last week on the medical home portal on making lists of service providers. So if you're interested in a refresher on how that goes, that recording is available. All the recordings are available on our Peds Echo page, and we'll make sure that that link goes out in our meeting summary as well. And you'll be able to see the rest of our session there as well. I can't fit it all on this slide. All right, I'm not sure if I even saw Athena on yet. There she is. Hi, Athena. Okay, I'm going to give Athena a few minutes and let her take over the drive. Well, maybe not.
Yeah, sorry.
Okay, yep, I'll drive. You talk.
Okay, great. So today, since Eric's going to be talking a little bit about Title V and what that means, we wanted to highlight a page on the portal that talks specifically about what a medical home is. So if you have here on our homepage, you can see that sometimes in the banner that about what is a medical home question rolls through the banner. It's also down just below the picture if the banner picture is ever not there. If you scroll down just a little bit, you can see what is a medical home. And from there, click on it to see. And this has some really great information about, what is a medical home as described by the American Academy of Pediatrics. It should be accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective care. And then in addition to that, it talks a little bit about what Title V funding is. So Title V, or sorry, also gives a definition of who are children with special healthcare needs, and then goes into a little bit about what Title V funding is. So each state receives a portion of Title V funding from the Health Resources and Services Administration, or HRSA. And that funding is specifically set aside to help ensure that services for children and youth with special healthcare needs are met. And it's to help reduce infant mortality, to make sure care is coordinated, et cetera, et cetera. And how those funds are used in each state does vary, but you'll find out a little bit more about specifically what the funds in Utah are doing today. And then down toward the bottom of this page, there are some links to the HRSA website where you can look up state profiles for each state to find out more about that funding, and some links to Family Voices and AAP as well.
Thank you, Athena. Yeah, we're greatly affected by the Title V.
Yeah, her out. Yeah, no, I agree. I agree.
I think we're just hearing a little bit of background noise. Remember to go ahead and mute if you're not speaking, but we love it when you speak too. So unmute then. All right. Thanks, Athena. That's great. Okay. Well, again, I think I accidentally pulled out some slides when I was goofing around just before this meeting. I apologize. This is actually the time where we hope that you will talk a little bit about what's going on in your world. So apologies that that's not up there, but that's what this time is. This is brainstorming time. And if there's anybody who wants to take the floor for a minute, please do. And I'm going to go ahead and be quiet and let you guys talk.
I'd be happy to present a case that Natalie Allen, our APRN, and I have worked on. We met with the family yesterday. It's a really complex situation. And so we could probably spend the rest of the time talking about it. So I'll try to kind of condense it. We did a virtual meeting yesterday with the mom. The daughter is 17 years old. They were referred to our integrated services program from High Fidelity Wraparound Services. I've counted 29 diagnoses that she has.
Oh my goodness.
They include ADHD, autism, POTS, celiac disease, food allergies, anxiety, suicidal ideation, infections, non-epileptic seizures, learning delays, gastric paresis. She has J tubes, so on and so forth. She's on several different medications, but they really kind of, anyway, she's on several different medications. It just surprised me after reviewing her information that when we met with this family virtually, that she was just this, I didn't expect her to be articulate and just walking around and, this cute little 17-year-old teenager. She just popped on the screen and said she had just changed her wound and packed it and was treating it for infection, and was very articulate and engaging. It's hard for us. A lot of their needs, when Natalie and I asked what was their biggest concern, it was because of her POTS diagnosis. It's like a postural orthostatic tachycardia syndrome. And so she has she gets dehydrated, she passes out, has to go in and work with their primary care physician and go into the ER every other day right now to get her IVs replaced. And her veins are just getting trashed, but because she has the open infected wound, she can't get a PICC line yet. So a lot of things that as a community program, we can't really help with, but we did establish that they have a good family practice doc. I mean, this mom was on top of it more than any mom that one of the most on top of it moms. They've got her on almost on the DSPD wait list. She's working with some autonomic clinic for the POTS. They have several specialists. She's just all over it. They're already in comprehensive care. We thought that we would refer to comprehensive care at Primary Children's, but they've already been going there and not finding help. So it was just everything that Nally and I knew to talk about with them. We're doing or already doing. So it was just really impressive, but also felt defeating because we didn't feel like we could give them much help. It came down to, we ended up talking about a referral to genetics based on like family history, and but it just seems strange that no one had referred them before, and they'd been seen by comprehensive care clinics. So they were going to go through, mom was going to go through comprehensive care clinic to get the genetics referral. So maybe there'll be something from comprehensive care when mom asked for that referral. We asked about transitioning to an adult provider because the family practice doc that they're seeing now, they don't have, it's not a medical home. It's not, they don't have a care coordinator, a case manager in their medical home. So that's one thing that I wanted to ask the group today, is if they had recommendations. This family lives in the Salt Lake area, and they need a primary care physician that is more of a medical home in the Salt Lake area. So I wanted to ask for recommendations. I did leave a message with Utah Parent Center yesterday, so maybe they'll call me back. I did look through the medical home portal, but I don't know if I was just searching it wrong, but I couldn't find anything. I found a psychiatrist, but I didn't find a list of adult medical home doctors in the Salt Lake area, and it's probably because I didn't search it right. So there's that I wanted to ask you guys. And then I don't know, Natalie, like as we kind of talked through this and looked through this, we did feel like we might be seeing some red flags based on all of these diagnoses in the conversation with mom, the conversation with the daughter. There is a part of us that is just wondering a little bit about like a Munchausen type situation. And there are just some red flags for that. And so I went back to the referral source and kind of chatted that up just a little bit. And, it obviously could be just this family that has fallen through the cracks and is so complicated that our community is kind of failing them because they are so complicated. But there are some kind of situational things that came up yesterday that you can't help but think that there might be some more going on psychologically. So anyhow, does anybody have any, Natalie, do you have anything to add? And I don't know if anyone has any recommendations or insight.
I just want to add that as we interviewed this family, sorry, I am not camera worthy. As we interviewed this family yesterday, I felt like some of the barriers were put in front of them because they I think they are refusing mental health services. And so the family really is kind of refusing to go back to Primary Children's because Primary Children's really wants mental health involved. And, I am the first person to always take the side of the family. I am. And so that's where I still am. And they feel like they've been failed by mental health providers. She has private insurance, and then they also have a secondary Medicaid. And so, yeah, I don't know, but there is that mental health component that I believe the family is kind of refusing to address. And that seems to be creating barriers for them from a medical standpoint.
Hey, this is Heidi with UPIC. I have just in my rounds and my past as a care manager and all of that, I find that I would be really curious why they feel like CompCare has failed them. Because I know the two care coordinators there personally, and they are amazing. But I want to also kind of caution, because anytime you go into an adult, the first thing they're going to want to do as a medical home is also get behavioral health involved, right? So I just want to say that I don't think that that's something that the family will ever get around. We had a family like this that mom was always blaming the school, you know, the daughter, she had her medical issues, and she was not complicated, but it was very much like we had to really sit down and have a conference with the principal, the family, the medical provider, to address what is it that we're all missing, because yeah, I don't know. I just don't think, I don't know. I mean, I have some recommendations for, I mean, I have some providers that are like IM Peds docs, you know, so they do work with that, but all of them will also get, they'll get behavioral health involved. They will.
I don't think they're absolutely opposed to that. It's just they haven't had a good experience with many clinics to date. And Heidi, like, yeah, that was the first time Natalie and I've heard someone that comprehensive care was of no use to them, that's the first time we've ever heard that, you know, because that was going to be our biggest recommendation upon looking at this in the first place. So I think mom feels, because she has so many diagnoses, because this is such a complicated, there's so many facets to what's going on, from wound care to knee pain to autism to they're going to go for home and hospice for schooling, that she thought that comprehensive care would be the place that would kind of help them organize all of this. And her side of it, her perspective is they haven't. So yeah. Because they were just seen 2 weeks ago. So
So what is their biggest need right now? What are
her IVs are blowing every other day, and they have to go to ER to get them replaced, and she can't get a PICC line because she has a wound infection from her J tube being around her J tube site. And the issues with POTS, her passing out, and those issues with POTS, she says everywhere they go, they just tell them drink more water, and that doesn't help. So it's, again, the referral, you know, we're not acute care. We're a community program. We're trying to help them, and a family like this needs help from a lot of different places, and you know, we're going to follow up with them. The other recommendation, Heidi, something that you alluded to, is we are going to follow up with mom virtually and the daughter with the caseworker, again, from High Fidelity, and then we're inviting other people in from areas like a care coordinator from Primary Children's, and I can't remember the other person we were going to have come forward. And then Natalie and I talked about, like, after that meeting, potentially reaching out to the primary care physician to see if she might be able to join us at some point.
Yeah, because I mean, I've dealt with children that have had, you know, that have been at South Davis, right? South Davis for years, and then they finally get released after so many years. And they do have a multiple of things, but they've been able to have home health come into the home. That was set up by CompCare. So yeah, that's a toughie. That is a toughie.
Yeah, and they have home health, and they said that, you know, they got home health, you know, that was one of our first questions too. Sorry, it's just so all over the place.
Yeah.
But they did have home health come in, but they were just kind of saying they can only address one issue. And so she might be having several things going on, but they're only going to focus on her wound care. And then the IV is blowing, and then they can't do that because they're just ordered to go work on wound care. So they have had home health come in, but they haven't found it extremely helpful either.
Interesting.
I got some stuff to
Tina.
say.
Tina.
Bear with my voice. I'm trying so hard to get it back. Okay. So the wound care around the stoma, that they should be seeing, like, focusing on that wound care, going in to get wounds fixed, right?
And they are, Tina, I'm sorry, they're seeing a GI specialist and a GI motility clinic.
Okay.
And this girl's 17 years old and she has been taught how to pack it and
Do her own,
treat it right
okay.
now. So she's doing what she can at home.
So yeah, that's gotta, before they can do anything else, really, they can't place anything in her body until that's gone.
Right.
But, and then having IVs done at home can be done, and it would probably be fine for me or you, but somebody's whose veins are blowing constantly, it's probably those special guys they call in up at Primary Children's ER to find that vein that's not really findable. So your general nurse that's going to come out to the house may have, who knows what her experience or his experience with IVs would be, but it may not be that level of, you know, people that can find very, very tiny veins in anybody, you know. So that could be part of the issue there of why it's easier for them. I know I wouldn't try in a million years to have somebody place an IV in my son at home. But again, he's different than this girl. But I just know it wouldn't work. You know, it just wouldn't, behaviorally, he wouldn't handle it well at all. So we usually need several people to help us there. Is she seeing a POTS specialist? Okay.
They're
and
getting
then-
into their next step is to get into an autonomic clinic
Okay.
for POTS.
Yeah, it seems like it's there's not enough doctors for POTS right now, but you're hearing about it more and more and more with people. There's like a couple people at work whose kids have it, and it's like, where is this all of a sudden coming from? I guess it's been around, but then the other thought is, you know, when I work with families who feel like they've been through mental health services and it's not necessarily helping them, then I offer to help them choose a provider themselves out there. And we get on to, I know it's not the portal, we need to somehow connect with this website, but I do get onto a website called Psychology Today with them while we're working together and help them drill down the database and find things that are close to them. And there's a lot of profiles they can read through and go, I might like to work with her, or I might want to work with him. And it's a little more than just saying we've got an appointment, we're going to walk into a clinic we know nothing about. So sometimes that really helps families to say, I've made this choice, I've read through, and you know, the young lady could probably look through some of them herself, and you know, you can drill down even issues in this website. So I do use that quite often to empower them to have a choice in picking their healthcare provider with mental health.
Thanks, Tina. The mom is saying that they want a psychologist or a psychiatrist that she's kind of wanting, I think, a psychiatrist to be knowledgeable about all of her medical diagnoses.
That's
is
gonna
what
be a
she's
hard one.
asking for.
You know
And
what?
so we were trying
I'm
to talk
happy
with her
to
about
work
that.
with the family on that part, and we can go through, you know, some of the things that are out there, you know, what happens. I mean, it sounds like she needs someone to talk to, and it may not be. I mean, at this point, hopefully the daughter has the voice here, and it's not just the mom speaking for her. So maybe we can talk to the family. If you want to refer her to me, because it would be me calling you today anyway, Natalie. So, or
Yeah.
Heather, whoever called in.
Heather, I think this mom would respond really well to Tina. I think this
I
is
do
a
too.
great idea.
Yeah,
I
I
agree.
think I can work with her and just say, hey, look, you know, I've got another mom who's, you know, got an adult that's complex, and maybe, you know, you can talk.
Thanks, Tina. That would be great. I'll reach out to mom, but she said email's the best way of communication. So I'll reach out to her again by email and see if she's okay with the referral. I think she will be. So
Okay.
thank you.
Yeah, and I'm happy to email back and forth with her.
Okay.
So
Thank you so much. I know we took a lot of time. I appreciate everybody's time. Thank you.
I have one more question too about them real quick. What, where did they live? Did you say?
In the Salt Lake area.
Okay, so the Sugar House Clinic has several adults, great adult doctors up there.
Okay.
Yeah,
If they're taking patients.
if they're taking patients. Yeah.
Okay. And it's not urgent. They really do like their family practice doc. She's 17 years old. They're not looking to switch tomorrow to adult, but I just am really concerned that they are with a family practice doc that isn't a medical home. More than anything, this kind of family needs a medical home to transition
For
to
sure.
eventually with a care coordinator. And, you know, anyway, so yeah, thank you.
Can I just say too, our service through Primary Children's Connector service is a little more intense care management than what comprehensive care can do. We may have already had a referral for this patient and we didn't know
Yes.
where we could help because we have had one for a POTS patient that was very complicated. But I don't know if there's a chat or a place I can put our referral form in. We'd be happy to look at the referral and see if it's something we could help, especially when you're saying about setting up the school situation and some of the things that would be care management. They don't have the type of hands-on help at comp care that we do. We take the same type of patients, but we do in-home care management outside of the hospital. So,
Corinne, I think you're a wonderful idea. I don't know why I didn't think of you.
well, I think the things you said are great. And we do, you know, we're called the connector service because we try to connect with the services that are out there, and Tina would be someone we'd be thinking of, you know, but I would think maybe a referral might be a good idea. And I don't know where I can drop that information for you.
At the bottom of the screen, there's a chat. If you put your cursor down at the bottom of your screen, and the toolbar might pop up and say chat on it. Or I can.
I'll look for it. If not, I'll send it in the email, like respond to this email or something.
Perfect.
Yeah.
Thank you. And they are set up, mom says, for home and hospice for school.
Oh, it is already set up. Okay.
That's what she in the process or almost set up, or like that. She alluded that they were about there to get it.
Okay. Yeah,
So-
I don't know. We would have to look and see if we could make a difference from what is being done, you know, but it's just a thought.
Thank you so much.
Mm-hmm.
Oh my gosh, this is really something. And Eva put something in the chat, and for purposes of time, Eva, I won't read that all out, but that's very interesting. We'll make sure that gets added into the summary notes as well. Another angle, another possibility for support. So really interesting. Yeah, we love Psychology Today. We wish we could be Psychology Today for Utah. They do a really good job. So no feelings are hurt there, Tina, whatsoever. Thank you, everyone. And Heather, my goodness, let's keep talking about this. And this might be a good one for the Facebook group, also kind of ongoing. So, all right, awesome. Well, I think I also eliminated a slide that talks about some of the updates recently to the medical home portal. So I'm just going to show you really quickly while I've got it up that we've added a couple of care process models that we're excited about. So the newborn transition care guideline is brand new, and the bilirubin screening and testing in newborns is a brand new care process model. So just to let you know about those. We've also added, I'm pleased to say, a new frequently asked questions page for parents on type 1 diabetes. And in fact, thank you to Eric Christensen's son for bringing a patient perspective to that. See if I can find that. Oh, there it is toward the bottom. So there you go. All right. Now I'm going to turn the time over to Eric, and I'll stop sharing and let Eric have some time to talk with us a little bit about the Utah Maternal Child Health Block Grant and our goals and how we're working on those.
Well, good morning. I'm glad to be with you. I think it's going to be hard to compete with that case, but we'll go ahead and talk through the Maternal Child Health Block Grant. I'm going to go ahead and share my screen. And let's see here. Sure, I get this right. And I apologize. It doesn't matter how many times you practice this, I never get any better with presenting. So let's go ahead and get the slideshow started. And I will share that screen. So just one moment here. And I can see some faces. We will, okay, I got a thumbs up from Mindy. So that's a good thing. So we're off in the right direction. For those of you who don't know me, I'm Eric Christensen. I'm the program manager with the Integrated Services Program. And I'm with the Office of Children with Special Healthcare Needs. The Departments of Health and Human Services formally joined together last July. And we've been in the process of kind of joining forces, learning what each other does, and kind of combining the best of the best to really supply as much support as we can and as much one-stop shopping to the families that we serve in this new joint organization. We've been going through a lot of changes, a lot of growing pains, kind of what you'd expect when you merge two families. You got, stepmom and dad and all the, the step siblings, and we're kind of going through that sort of a thing right now, but we're finding a lot of really great opportunities to join forces and find ways to hopefully more expeditiously serve that very same population. Today, I'd like to talk to you about the Maternal and Child Health Block Grant. And we'll talk in just a minute or two about some of the ways this funding, when it comes into the state, how that money is used and the type of programs that it funds. And some of you might know some of this already, and some of you, this might be some new information. So please know that at any point, I want this to be kind of informal. I'd like you to be able to ask questions and feel like you can pop in at any time. We're going to gloss through a whole bunch of this, though, because at one point, we're going to divide you into some rooms and let you just kind of explore some data that we're going to give you the opportunity to look at in just a minute. So let's look at Title V and how does it help moms, infants, and children. Back in the 30s, when they were going through all sorts of New Deal kind of projects, Social Security came around, and one of those titles, Title V, was a big focus on working with making sure moms and kids had the kind of health care that they needed. Through the years, those agencies have kind of morphed and evolved and changed names, but funding currently comes from HRSA, from the Health Resources and Services Administration, and more particularly from the Federal Maternal and Child Health Bureau. Athena kind of alluded to what some of that funding is used for, but in more broad terms, over on the purple side, that funding allows states to basically provide healthcare services at the discretion of the state to moms, kids, children, and youth. And a subset of that is to really look at ways to reduce infant mortality. So let's focus on having healthy moms, healthy deliveries, healthy pregnancies, ways to increase regular screenings, follow-up diagnostic care, ways to partner with Medicaid to ensure that our kids are getting seen for timely screening, diagnosis, evaluation, services for children with special healthcare needs. And that's really a lot of the reason that this organization exists, because we all work with kids with special healthcare needs. So UCCCN is a part of that. And definitely that coordinated care for children with special healthcare needs. And then one of the pieces that they fund as well on a national level is that ability to provide assistance to help families receive Medicaid benefits. We know quite often it's hard to maintain those benefits. And so there's some assistance there to ensure families have that coverage. And knowing that we're going out of that COVID emergency status, we know a lot of our families who've been able to maintain Medicaid eligibility are going to be dropping off the bandwagon on that. So we hope that conversation is happening with families who are on Medicaid to try to ensure that they can maintain that eligibility status. So if you're not having those conversations with your Medicaid families, please do so. And if you need help with any of those families, make sure you refer out. We can help with that as well. So how does a block grant work? Money comes into the state every year to every state in the nation and a lot of our territories, but you have to apply for it. I'm going to say in air quotes, apply for this. It comes in, but you have to do an annual report and you have to submit goals every year for what you're going to be doing for that year. So there are areas of focus. They're called national performance measures. Every state can choose from the national performance measures. I'm going to show you what those are in just a minute. So there's a kind of a laundry list of those national performance measures. Each state chooses some of those as areas of focus. And then states have the ability to create what they call state performance measures, areas of focus within the state that are especially important to that state. You're not required to create state performance measures, but most states do. And what those states choose is based upon a needs assessment. And by law, each state is required to do a needs assessment every 5 years. We last did a needs assessment in 2020, and we contracted with University of Utah through their Department of Public Health. And they did a statewide scan and needs assessment for us. In 2024, we will be putting that together again for the next 5-year grant cycle, 25 through 29-ish. And we'll be basing a lot of the goals and objectives that we work on for the Maternal Child Health Office and the Office of Children with Special Healthcare Needs based upon that upcoming needs assessment. And a lot of focus groups, a lot of different key stakeholder interviews go into that. And we'll be prepping to do that next year. And I have a link on this slide that shows the needs assessment and what was done. So you can all look at that a little bit later on if you are so inclined, because we will make these slides available to you. So these are the national performance measures. And the ones that I have highlighted on here are the ones that Utah is working on. And if you want more information on what these entail, we can take this offline. I'd be happy to tell you a little bit more about these. But we work on in Utah, number one, the well woman visit. So making sure that that women are receiving kind of those annual checkups to ensure that their reproductive health is good, mammograms, things like that. And then number 4, breastfeeding. We encourage breastfeeding in the state and all the initiatives that go along with that. Number 6, developmental screening. So those are things like ages and stages questionnaires, the MCHAT, some of those other type of early screenings for autism. And you can look at some of these other ones that are not in italics, all important things, but we don't have to choose everything in the state. So we have chosen those 3 from this slide. And then on the next one, 11, medical home, 12, that transition to adult medicine, and then 13, preventive dental visit. And just want you to know, some of these have subsets. So 13 has a subset. They want to know perinatally, were women getting dental care? And then there's another subset about children receiving preventive dental visits as well. And I think in Utah, we're only looking at that child preventive dental visit, not the adult dental visit. A lot of times for adults, it's if you don't have insurance, it's hard to get dental care, even on Medicaid. So I think we look at the pediatric one from that other perspective there.
Yep, that works. So work. Yeah.
Are there questions or just background chatter? Okay, just want to make sure I'm not missing a question there, folks. Okay. In the state right now, in our block grant, we have 3 state performance measures. The percent of moms who indicate a healthcare worker asked if they were feeling down or depressed. So maternal depression. We have a big initiative through the Maternal Child Health Bureau on that one. Number 2, the percent of family members in the same household who ate a meal together 4 or more days per week. And then state performance measure 3, the percent of students enrolled in free or reduced price lunch programs. So I'm really encouraging that from a nutritional standpoint. So each year, our block grant, we have 2 parts, like I alluded to initially. We do an annual report. So this year, we will be submitting in July an annual report for fiscal year 2022. That started July 1st of 2021, so middle of the pandemic, and went through June 30th of 22. We send information in on the state fiscal year, even though this grant runs on the federal fiscal year, which is October 1st through September 30th. So all of these different dates running through everything, but we report on the state fiscal year. And let's forget about the calendar year in there, which is sometimes really nice, easy data to report, but on this one, we're gonna report on that state fiscal year. They also want to know the annual plan. So they want to know, what do we plan to do for this next fiscal year that's coming up for fiscal 2024, and that's going to start July 1st of 2023 and go through June 30th of 2024. That little blue graphic I have over there on the left is the cover page for our most recent submission for the Maternal and Child Health Services Title V Block Grant Utah submission. Just so you know, when we submit that, it's 415 pages. And that involves a lot of different people who contribute to that. I'm a core writer for the Children with Special Healthcare Needs section, but we have a whole bunch of other writers who contribute to this, and we all put it in an internal system here called the WEST system, through the Division of Family Health, and then that information gets uploaded into TVIS, the Title V information system on the federal level, where all of this information is compiled and they produce reports so you can get a state by state snapshot from a federal level and be able to look at what every state is doing on the block grant. And we in the state, I've put a link here, so just you can see this is the link to the most recent block grant that is public knowledge, and you guys are able to look at that anytime you like. And I'm just looking to see, is there anything in the chat I need to be aware of, or are we good? Okay, so that is right there. I will give you links to our websites, the Maternal Child Health website and the Children with Special Healthcare Needs website. I was going to show that to you, but I think I'm going to screw up my presentation if I do that, and I'm not brave enough to click out of here. So I'll give you those links after, but we'll show you the types of programs that we fund in the state. On the maternal child health side, there is funding for maternal mental health, for some breastfeeding. They do a perinatal mortality review for cases of children who are stillborn or some perinatal demise. On the Children with Special Healthcare Needs side, we fund integrated services program. We contribute to Medical Home Portal, to the Utah Children's Care Coordination Network. We fund some services through Utah Parent Center. We contribute towards the Transition University. Some funding goes to the Children's Center. So there are a bunch of different programs that we help to support to a certain degree through these funds that come into the state and that subcontracting. I'm going to show you next just a couple of the pieces that we are responsible for directly out of the Office of Children with Special Healthcare Needs. And that is from our I'm going to show you last year's, or what we submitted in 2023, our annual plan. And this is National Performance Measure 11. And that National Performance Measure 11 says the percent of children and youth with special healthcare needs ages 0 through 17 who have a medical home. And this information comes off of the National Survey of Children's Health, and we're going to show you that in just a minute. But the National Survey of Children's Health is done annually. It's a random sample survey. They call approximately 750 families in the state. And there's a pre-screening questionnaire to determine whether the kids fall into regular pediatric population or whether they are determined to be a child with special healthcare needs. Certain things would determine that. Do kids have a chronic condition? Do they have behavioral health concerns? Do they use services at a frequency or of a type more than the general population? So that pre-screening questionnaire will determine whether they're, again, general pediatric population or kids with special healthcare needs. So once that's been sorted out, answers come back in on those questionnaires and determine the responses that come back annually on that National Survey of Children's Health. And so we base our goals within the block grant for the Children with Special Healthcare Needs section, National Performance Measures 11 and 12. We base some of our goals off of what the responses are on that National Survey of Children's Health. So our objective on here is by 2025, we want to increase the percent of children with special healthcare needs who receive care within a medical home from 40.4% to 57.5%. Now, that looks like a pretty huge jump, but the data show from the survey that we were kind of teetering around that 40-ish% range back in 2019, 2020, but the trend has been going up. And so we said, well, let's try to hit up into the high 50s for our goal as we were looking at what some of those trends were and as we worked with some of our epidemiologists. So we have created evidence-based strategy measures. So just so you know, that's what an ESM stands for. We live in a world of acronyms. We thrive on them in government. And so this is no different, but our evidence-based strategy measure 11.2 said, we're looking at the percent of children with special healthcare needs served by the Bureau who have a documented care coordination follow-up as part of a medical home model of care. So we're specifically looking at what my team is doing here in the Integrated Services Program as far as the follow-up that they are providing to the families that they're serving. Now, we would love to be collecting this on a statewide level, but it is very difficult to try to coordinate all of that data amongst all of the very practices. So I want you to keep that in mind, because I don't want to say we don't ever want to do that, but our methodology for doing that has been a little bit tricky. So keep that in mind, because I would love to be able to, track that on a statewide level and say how many of our practices put a care plan in place for their families and have ongoing follow-up with those families to keep that care plan vibrant. Our next strategy measure is 11.3. % of families who participate in a practice who is part of the Utah Children's Care Coordination Network who report satisfaction with the components of the medical home. Let me ask you guys this. When is the last time you remember me reaching out to you and asking if I can survey any of your families to see how satisfied they are with the components of the medical home? If you can remember a time, you are living in a parallel reality, because we never did that. So we made that as a goal in our block grant for last year, but we have not reached out to kind of survey some of your families. So keep that in mind as well, because we know we survey the heck out of families, we survey the heck out of providers. We love surveys, we love to get those results, but what happens every time you get a survey through your email? Do you kind of cringe just a little bit? So anyway, think about that one as well. That's what we put for a goal, because we thought that, let's tap into this resource here, the Children's Care Coordination Network. If you're coming to these meetings, chances of you being, medical home is probably pretty good along that trajectory of medical home. We'd like to tap into, seeing what your families think. Haven't done that one yet. Okay, the next slide is a gnarly, messy one, and I'm not going to read through all of it. But let's just show you, these are the strategies that we put in. And some of these are old from 2020. We didn't clean them up, but they talk about funding, creating work groups, some of the things that we've done to have an ongoing presence for talking about medical home and ways we think we can improve that in the state. You'll have access to these slides. I want you to look at these later if you can, but kind of think about this a little bit later of, things that we've put into the block grant for activities we want to look at, but are they still important? Or are they still things we should be looking at as we consider, working towards making medical home making the medical home stronger in Utah and making it be something that folks have better access to. Okay, number 12 is the percent of children and youth with special health care needs 12 through 17 who receive services to prepare for the transition to adult health care. So talking about the eventual transition to adult health care, helping families prepare, doing readiness assessments, getting them eventually moved into that adult health care arena. And our objective is to increase that percentage from 17.5% to 21.5%. Neither of which are lofty goals, but we have some pretty low response on families who respond to, in the affirmative, to whether they're receiving those types of services across that continuum of care. So we want to know on our strategy measure, what we want to measure, the percent of kids who report that transition plans are assisting them in making that transition, the percent of adolescents who receive or help to prepare a transition plan or who are actively involved in some sort of a transition plan. And then lastly, the percent of providers trained in transition who have a transition policy for adolescents and youth in their practice. So number of practices who actually have a transition policy. These are our strategies, so not quite as heinous as the ones that we had that massive list for the medical home. And these are the ones that we reported last year on the block grant. Right now, we have a medical home committee and a transition committee. We've been meeting for a couple of years to try to move these along. We meet monthly and we work on block grant goals, our evidence-based strategy measures, and strategies for children with special healthcare needs. Now, I'm going to tell you the overall objectives and goals for the block grant haven't changed so much over 5 years, but as Mindy will tell you, those evidence-based strategy measures have kind of moved around a lot because we'll create something we think we have a really good basis for data. We think we can make it work. And we'll set this, we'll write it in the block grant, we get working on it, and we'll say, boy, we don't quite have what we need to really make this come to fruition, or good concept, but we might need to take this off by 30 degrees to make it happen. So the evidence-based strategy measures are great because they allow us on a state level to say, what can we really measure? What can we have impact on? What can we really show progress on? And if we need to tweak that, those types of things, we can really move those. So I want you to keep that in mind because we're going to ask for your help a little bit later on. So kind of keep that piece in your head as well as we move through this. So National Survey of Children's Health, I mentioned that just a few minutes ago, and that provides the data for us on all sorts of things, other measures, other things we look at in the block grant, that it provides data for us on National Performance Measure 11 and 12. By the way, those are the only two national performance measures that really target children with special health care needs. And I just want to let you know that the money that comes into the state of Utah is between $6.1 and $6.2 million each year. 30% of that money by law has to be spent on children with special health care needs. So we know right off the top, we have to target some of that money on this population. And National Performance Measures 11 and 12 are really the only two national performance measures that focus on this population. Now, built within the National Survey of Children's Health and scattered throughout the Title V block grant application are some things that are called national outcome measures. And they are certain things like the percentage of children and youth with special health care needs in the state that report as having, or the percent of the pediatric population in the state that report as being children and youth with special health care needs. That's considered a national outcome measure. Or the percent of children and youth that have adequate insurance in the state. That is a national outcome measure. So the national survey reports all of those sorts of things. So I am going to show you this next slide, and I'm going to show you also a demo on the National Survey of Children's Health, and then we're going to break into groups, and we're going to ask you to find a couple of things. So let me show you this slide. And what I should have done is let everybody have a copy of this. And Mindy, I'm not quite sure what's the best way to do that, because that was not great planning on my part. But these are the sort of things we'd like for you to see if you can find when we break into a group here really quickly. Number of families who report having a child or youth with special health care needs. So again, an outcome measure. Percent of families with a medical home. So National Performance Measure 11. Percent of families who receive transition to adult medical services. And then want you to be able to explore explore the national outcome measures and explore the child and family health measures. And then a couple of little, not assignments, but a couple of things that you might contribute to our block grant this year. What, if any, themes, activities, or measures do you feel might better contribute to our national performance measures 11 and 12 for progress and for success? And then I just lost the screen here. I apologize. I hope I'm still, there we go. I moved my computer, and the last one was, I'm sorry about that, guys. And the last one was, what have you noticed in your office or agency or practice around your population that would contribute to those strategies for either NPM 11 or 12 or both? So let me get out of this for just a minute, and I'm going to minimize that. And trying to decide, Mindy, how I can, let me stop sharing for a minute, and then I'll share again when I pull up the National Survey of Children's Health. So give me 1 sec here.
Okay. Well, I just took a quick screenshot of
Sounds good. Thank you.
that. And I don't know, depending on how we do our breakout groups, we can probably share that
Okay,
around.
okay. Let me go ahead and share my screen again, and I'm going to just show you really fast where this is. Okay, so it's childhealthdata.org. And let me share this with you really quickly. So are you guys able to see that now? Okay. Yep. So National Survey of Children's Health, you're going to go to the Explore the Data, Interactive Data Query, 2016 to present. You want to choose the 2021 2 years combined. You'll then select Utah. And then right here are the child and family health measures. And they're broken down into all of these here. And then if you want to find the national performance measures, they're right there. So 11 and 12 are there. So you can find those percentages for our current 20 and 21, percentage of kids with special healthcare needs who, have a medical home and who are doing transition. And I'm going to cheat just a little bit for you. National outcome measures, children with special healthcare needs is under the outcome measures. Okay. So we'll let everybody divide into groups, and we'll kind of hop around and see if we can help you guys find this stuff. And we'll hop back on in about, I don't know, about 10 to, so in about 13 minutes. Does that work okay, Mindy?
I think so. That sounds
Okay.
great. All right, I think Michelle's going to plop us into groups
Michelle's
here.
gonna break us out.
Thanks, Michelle.
Here. This is Tina.
I'm a little unclear on what we were supposed to be doing. Does anybody else, did they get the directions a little bit better than I did?
I didn't take a screenshot of the questions that he wanted us to search, so I'm sorry, I'm not very helpful.
You did or didn't?
I did not.
Oh, no. Here, let me-
I thought someone else in our, never mind, it doesn't matter.
Let me see if I can find it.
Thank you, Michelle.
Yeah, and I'd share my screen other than my Zoom keeps crashing every time I do that. So I, if somebody else wants to share theirs with that website.
I also failed to take a picture of what our instructions were.
So we all must have not we were all just enthralled in everything, but I guess maybe could anybody tell me like when you use this information, or when people gather it, if we go to the site, or what do we do with all the information that he gave us? I'm new to care coordination, but I have a social work background. I'm just curious.
A great question, Eva. I actually had the same question in terms of like the day-to-day practicalities for most care coordinators. I don't actually think you probably would use this information. I think it's nice to know, but I think it's mostly used for funding purposes for HRSA. So yeah, I'm not totally sure. Sorry, you put something in the chat there, Michelle, didn't you?
Yeah, so this is
Okay.
the list of things. It says with your group, please explore
Okay.
the following using the 2020 to 2021 and the SCH data set, select Utah.
Okay, so percent of families who report having a child or youth with special health care needs. Hmm.
Hey, I'm good. I know.
I'm having a hard time actually finding the answer to this one in the data set. Here's the link there too, if anybody else needs it. One or more current lifelong health conditions, is that it maybe?
Athena, what site are you looking at?
I'm looking at the childrenhealthdata.org site that he shared.
Yeah.
Yeah,
Okay.
thanks. Who's ever sharing? Is that you, Michelle?
Nope.
Oh,
Oh, it's
somebody
Heather's.
else. Great. So it's saying that 16.9% of children report having or families report having a child or youth with special health care needs.
And I'm sorry, I'm sharing, but now I can't see my screen.
Oh, shoot.
Oh, I don't know. I apologize, but there it is. I can try to find another one.
Yeah, so what was the next one? How many families report having a medical home? Oh, I think I found that one.
Okay, I'll stop sharing.
Says 54.6% report having a medical home. And then how many receive transition services? Transition, there we go, indicator, transition. Did your child receive transition services? So only about 13% report having received transition services for children ages 12 through 17. So I think his question about what you've noticed in your own work with children with special healthcare needs would be interesting, like to kind of compare with what we're seeing here. So it was like 16.9% of children or children and youth with special healthcare needs. About 54% have a medical home and about 13% receive transition to healthcare. Does that seem to align with kind of what you see in your own practices or in your own work? Does it seem too much, too little?
I think for my area, it might be a little bit higher.
Yeah.
But I think that sometimes that goes hand in hand with low income areas.
Yeah.
So, you know, where a lot of our rural counties are low income, that might be what is primarily, you know, driving that. I'm not sure.
Yeah. I think the medical home question is interesting. Do you think a lot of families know and understand what that means? Yeah, I kind of feel the same. I saw some head shaking. So Heather, that made me think about your question with the family that you described in the case study of saying that they needed a medical home practice. Like, do they even really know what that means or what the benefit of that would be versus just a provider that they're really comfortable with at the moment? Or
Yeah, we had a discussion yesterday regarding that because I asked that question about who they see now and kind of explained what we want to look for as they transition into adult services, because they don't have that component. And so it was a good education piece.
Yeah, that's great. Good. Good.
Well, hey, folks, I got brought into your room and sounds like you're having pretty good discussion. So you probably don't need me being the dodo in the room. So anyway, what have you looked at so far?
We looked at the percentages for those top 3 indicators, and then we were having a discussion about like whether or not we felt like those were in line with things that we were seeing in our own work or our own areas or practices. And we feel like it does vary a lot by location and socioeconomic status. But we also just brought up the question of whether or not we think families know what it means when you ask them if they have a medical home. We're not really sure that families are actually probably very clear on that terminology.
So can I share my screen for just 1 minute with you really fast? Okay, make sure I'm sharing the right one here. So when you look at National Performance Measure and you look at the medical home, so let me just make sure I've selected the right one here. So I do have Utah 2021. So when you look at children with special healthcare needs on medical home, we know it was 55.7%. And, you know, as you know, you can, you know, semi-stratify it by like type of health insurance or whatever. But when you look at this, if you click this info button, It gives you the components of what determine medical homeness. So it explains right here, these 5 pieces, and then just these additional notes here that basically said, the presence of a medical home was measured by a composite based on 5 components constructed from a total of 16 survey items. These components are these. So to qualify as having a medical home, children must meet the criteria for adequate care on the first 3 components: personal doctor or nurse, usual source for care, and family-centered care. Any children who needed referrals or care coordination must also meet the criteria for those components in order to qualify. So basically, if you said, I needed a referral and I got it, and I need care coordination and I got it, then you qualified on that one.
I see. So it
So
was.
they didn't, I don't get the
They
sense
didn't
they
just
say,
say.
do you have a medical home? Do you
Yeah, they
participate in
asked
the medical
a bunch
home?
of different
So
questions.
yeah, so I don't think
Okay.
it's so much the vernacular
Which,
there. It's
but
kind of-
then though goes to demonstrate that probably most people don't know what that means.
yeah,
So.
yeah. So that's kind of what that one is. That one is looking at. Where it gets really interesting on some of this stuff is when you look at some of these, like child and family health measures, like health insurance coverage, or child and family demographics, some of these other parts and pieces. I think that's when, that's where I'm kind of wondering is, are we missing a group, or are we missing someone we could be working on to increase medical homeness, or are there better ways or better strategies we could be employing within the block grant, and working through groups like Utah Children's Care Coordination Network or the Medical Home Portal to really enhance some of these, the outreach or the activities that we do, to kind of show progress towards medical homeness, if you will. And then, there are those national, outcome measures that in the state, looking at our national performance measures, we really only affect certain national outcome measures. So the fact that we only choose like 5 national performance measures means we only really affect this handful of these national outcome measures. So really looking at some of the, child and family health measures are some of the things that I think, could be really interesting to look at in conjunction with these national performance measures. Again, for us in children's special healthcare needs 11 and 12. All right, and I think we're probably about ready to head back to just our regularly scheduled programming. So I'm gonna see about jumping back out. And need to message Michelle.
I'll go ahead and close all the rooms, and
perfect.
so give us a few minutes to wrap up if we need.
Sounds good. Sounds
Okay.
perfect. All right, I appreciate it. Thanks.
Thanks. 60 seconds.
Sounds good.
Well, I pulled up the same, I thought, table that he did, and I got different numbers. It's the same year. I can't figure it out. I was looking at his and mine, and my numbers are 54.6 and 45.4 for yes and no. So I don't know.
Maybe you were in a different drop-down menu. I don't know. Maybe probably a good question to ask as we get back to the main room.
Yeah. It's
Everybody back. We're going to wind this down here really quickly then. All right, I do not know why this is not progressing here, but I cannot get that last screen. Are you guys seeing that national survey questions up there again?
Mm-hmm.
Yeah.
Yes.
I cannot get that to go away for the life of me. So let me stop sharing there. And do share screen again. All right, folks. Well, I'm not getting that to go away. So I am just going to flat out ask you, what were any sort of takeaways any recommendations, anything you discovered on that. I would have liked to have given you a little more time. I apologize for that, but any sort of takeaways or anything you discovered kind of looking at some of that data on the National Survey of Children's Health? And I guess for me, selfishly, I want to know, as you looked at, as I showed you some of those activities we're doing, we looked at our evidence-based strategy measures. Was there anything you looked at block grant wise prior to looking at this that you said, ugh, why in the world, why in the world did you choose that? Why are you working on that, for heaven's sakes? Anything like that? Or did you have any takeaways, anything you'd like, us to maybe consider or work on differently? And if not now, you can certainly send those to me after the fact. So let me ask a couple of questions. So here we go. What is our current rate of children with special healthcare needs? What is that percentage? How many children with special healthcare needs in the state? What rate is that?
16.9.
Okay, 16.9%. Did that surprise anybody? Is that what you thought, or higher or lower?
I thought it would be a little higher.
Okay, nationally it's closer to 20%, but in state we're at 16.9. What about the medical home national performance measure 11 for children with special healthcare needs? What did that come in at? Does anybody remember that one?
It was over 50%.
Okay,
under 60.
Okay, 55.7%. So pretty good on that one. Actually, that surprised me. It was better than I thought. They don't actually use the term medical home when they ask folks. It's a bunch of different types of questions to figure that one out. And what was the one on transition? Knocking it out of the park on transition, folks. Do you remember what that one was?
I'm desperately scrolling to try to get back to it.
Okay, we're at 19.2%. Now I'm going to tell you what, that does not make my heart go a flutter, but it was better than the like 14-ish% we were previously. So we're making some progress there. Our 5-year though average on that's actually at right around 20%, 19.9. And with all the work we're doing in the state on that, things are looking good. So my next piece for you, I wanted to show you was, I would really love to invite any of you in this group to participate in our ongoing committees. We meet once a month, 1 hour per month on the meeting, sometimes some small, little assignments between meetings. But we have our medical home committee and our transition committee. Transition committee usually meets the last Wednesday of the month at 1 o'clock. And our medical home committee meets the first Wednesday of the month at 1 o'clock. And we would love to have any of you who would like to participate in those to help kind of shape what we do with the block grant, the types of activities we do, and the direction we take with the block grant. We'd love to invite any of you to participate on there. So that is my email address, and please reach out. We'd love to look at ideas, thoughts. When you come from that practice or agency perspective, we think we could really get some good ideas coming in from there. And then very last, just my contact information. So please reach out. I want to thank you for that today. I appreciate you letting me take a little bit of time. Just want you to know how that money is spent. If you have additional questions, please reach out. We can, kind of give you a list of how MCH block grant is handled in the state and how we utilize that to make things happen for moms and kids in the state.
Thank you, Eric. That's great. And we'll make sure that goes out in the meeting notes for sure. I participate on those committees, and it's a really nice group who does it. So just to let you know, it's it's a great hour or so with lots of good ideas and really good people, and we're seeing some really interesting things. So in the minute that we have left, I found my slide. Here's a few of the other updates that we've done to the medical home portal that you might want to know about. And I wanted to just mention the postpartum depression screening has been recently updated too. I think that's a really good page. And we've been trying to do motivational interviewing minutes. We'll tackle this one again in March. Increasing change talk. And finally, our next meeting is March 15th, 30 days, not quite. February always screws us up. Anyway, March 15th, and we'll look forward to seeing you guys then, and watch for that invite to the Facebook group, and have a wonderful rest of your week. It's a little chilly, but hopefully it'll be warming up by the next time we see each other. Take care, everyone. Bye.
Take care.
Thank you.